Hi, Dr. Baumholtz, and I got asked this question this week. Is there such a thing as a breast augmentation that's too big, or a breast implant that's too big? Well, let's see. I guess my answer would be it depends. It depends on what the person's goals are, and it depends on whether we're going to respect the anatomy or not. So, for example, the way I will start a sizing process with a patient is I'll measure from the edge of the breastbone to where the ribs turn into the armpit. And based on that width, we'll then pick implants based on how much we want the implant breast construct to stick out from the body. Someone says they want to be bigger, we really have two choices. We can go taller or we can go wider. And when we go wider, at some point, we're going to come off that. We'll be wider than that base diameter or breast width, and the implant will begin to go towards the armpit. And as you go wider and wider and wider, you're off the anatomy. And if your arms are at your side, you're pushing all of it forward, you can look quite large. But when your arms are up, most of that material will be out into the armpit. And the more anatomy you break down, or the more anatomic parameters you start to manipulate, the higher the risk for what I would consider a complication or an unwanted event. So as it goes further into the armpit, I don't think anyone really wants their implants down in their armpits. As you lower the fold further and further, you run the risk of either seeing a residual fold from the original fold or the implant bottoming out underneath. As we get into the super, super big cases, we start to increase the risk of losing nipple sensation, losing the nipple outright if it really gets gigantic. So there's all sorts of things. The way to go bigger and bigger, if someone is so inclined, is to do it in stages. Because if you go too big too quickly, you can develop stretch marks of the skin of the breast, just as you could any other place of the body. Well, that's a brief overview of how big is too big. It is certainly an individual decision, and one that we'd be happy to help you with. I'm Dr. Baumholtz. Look forward to visiting with you. Bye-bye.